The Cannabis Show is for information only. Nothing contained in the show is intended to constitute professional advice for medical diagnosis or treatment. We do not claim this information to be complete or exhaustive or to be applicable to any particular individual's medical condition. You should always consult with a qualified and licensed physician or other medical care provider.
Hi, and welcome to the Cannabis Show. Today we're going to be speaking with a patient. Also, Basil will tell us exactly what a terpene is, and we'll dive into the world of strawberry diesel with Strain Explorer. Hi, and welcome to the Cannabis Show. I'm Chris with Natural Health Services, and today we have our very first patient who's agreed to volunteer her time to come on the show and tell us how medicinal cannabis has helped her so far. Welcome, Eliza. How are you?
I'm well, thank you, Chris.
Excellent. Well, so when did you start out with Natural Health Services?
I've been a patient with Natural Health Services since January of this year.
So January, so it's been like 4 or 5 months now we're at. Has it worked?
It most certainly has worked.
Right.
I've been a chronic migraine sufferer since childhood, for about 30 years. And I was at the point where I was having 28 migraines a month. And I tried numerous preventative medications, none of which were effective. And I just wasn't happy with suffering.
28 days a month.
Exactly.
Yeah, that's crazy. That's almost one every day.
Mm-hmm.
So you found these prescriptions, they just weren't really helping at all?
No, they weren't, and they had terrible side effects, and they weren't worth taking. So I was getting migraines. I did have a prescription medication that worked to take the pain away, but they would take about an hour to 2 hours to kick in. So that was, a part of my day that I was in pain.
What were some of the side effects that you were getting from the drugs that you were prescribed?
Gastrointestinal digestion issues, and most of them just didn't work.
So, and then it was just kind of like you thought you got to try something else,
Mm-hmm.
and then medicinal cannabis just kind of came into your ear?
Yes, a friend of mine had told me that the cannabis, it's not just THC, there's also CBD, which doesn't have the euphoric effect, and that's something I wanted to try because I still wanted to be able to function throughout the day and be able to take it. So
you take strictly CBD,
mm-hmm.
and do you do the oil or the bud form?
I have tried the oil. I'm still experimenting with that in order to prevent the migraines. But what I have found is vaping CBD has actually been quite helpful. Once I get my aura for my migraine, which is my heart rate goes up and I get shallow breathing. And once that happens, I vape CBD herb and it just goes away.
It's almost, and would you say it's almost instantaneous once you vape that bud?
It's within a few minutes.
Really?
So the aura goes away and the migraine pain never comes.
So, and you're pretty good for the day after that?
Mm-hmm.
And you just find it's just one session of vaping as well?
Sometimes I have to do it a few times a day because the aura will come back, but a lot of the times it's once a day and then I'm good.
Now, you getting any side effects from the CBD?
Absolutely no side effects.
Really?
Mm-hmm.
So it is working for you
Mm-hmm.
on many different accounts. Do you recall or do you know what types of strains you use?
I use CanTrust CBD #1 as well as Afria Treasure Island.
So now when you open up your little canister and you look at it, it looks like what you think like what cannabis would be to get you high and stuff like that.
That's right, yeah.
But it doesn't
exactly.
do that. You don't get high,
Mm-hmm.
but you just feel a lot better.
Yeah.
Oh, that's
I just
excellent.
get relief. Yeah.
Now, what about the impact? Like, when you were getting all those migraines before, like 28 a month, you were saying, your day to day, I guess it must have been really difficult just to function.
It really was. It really was.
And then you had to have, you had those side effects to deal with after.
Mm-hmm.
So how is this I assume, improved your life since you've been using CBD bud.
It's been life-changing. I've gone from having 28 migraines a month to about 7.
Just 7 now.
Yeah, drastic.
And now when you get those 7, does it still help the vape, or is it sometimes it's just like it's a lost cause, that migraine?
If I do get the pain, I find that I haven't been able to find a strain that can take the pain away yet.
But still,
there's still hope.
Yeah, but you've cut it down to a quarter as opposed to 28, which those other drugs weren't helping out. Wow, that's incredible. For new patients out there, because there's still so many people, they get that stigma about cannabis, or it's just like this, a stoner type thing. But I think we're starting to move on beyond that. But what would you tell, or what advice would you tell a new patient?
I would just let them know that it's definitely worth trying. There's hope. And I never thought I would get such good results. So if it helped me, I thought for sure, that this was just my life of chronic pain. It doesn't have to be that way. So I just want everyone out there to know that it's definitely worth trying.
Oh, that's excellent. The process itself, just about Natural Health Services, you booked up online, naturalhealthservices.ca. You can book an appointment. You went and saw the doctor, then you came down, spoke with the Bud Genius. How did you find that?
I thought the whole process was just great. Everyone upstairs in the clinic, it was really, really great. Very compassionate doctor that I saw, and then I came here into the education center, and I really just felt at home. Like, I felt very welcome here. The Bud Geniuses are really great at what they do.
How much knowledge did you have of cannabis before you spoke with your Bud Genius?
Nothing.
Nothing. So he or she just really helped you out on what you got to pick and stuff, and you went from there. Picked your provider, and all right. Well, that's quite the story, and we really appreciate you coming on set with us, Alicia. That's awesome.
Thank you so much, Chris.
If you want to share your story on The Cannabis Show, you can email us, thecannabisshow@naturalhealthservices.ca.
What are terpenes? As I like to say, terpenes are merely some of the many organic molecules found in the plant world, as well as a small section of the insect world. They are produced and excreted for a variety of reasons, including deterring herbivores or attracting predators and parasites that would attack said herbivores. They are responsible not only for the flavors and smells produced by plants, but also a large amount of effects that we use our plants for medicinally. Specifically in cannabis, terpenes are a major reason why we have so many different strains. Unique terpene profiles alongside unique cannabinoid profiles give each strain its own chemical signature. This is part of the reason why we are able to group the majority of strains into 2 separate categories, sativas and indicas. Most of the plants in the sativa category exhibit similar terpene profiles, while the same is often true for those in the indica category. Many licensed producers now give us an idea of which terpenes are in higher concentrations in certain strains. Many of us use this tool as a roadmap in the journey to finding the right cannabis strains for our symptoms.
The Strawberry Diesel strain is a delight for anyone who wants to be alert yet relaxed. It is the child of New York City Diesel and Strawberry Cough, and the result is an equally strong flavor of diesel and sweet fruit. Anyone who battles with social anxiety may want to try this strain, as it is filled with terpenes such as limonene and caryophyllene, both of which are known to help anxiety ailments. Recommended for daytime use, Strawberry Diesel is best used with vaping, as the taste will make you feel like you're eating a dessert. Perhaps a good scenario for using the strain would be hosting a picnic, where you have to be alert for tending to the barbecue, among other duties, while feeling calm and stress-free at the same time.
It's the Strawberry Diesel.
From the coast that is broken. Yeah, Broken Coast Strawberry Diesel. It's definitely true to its name, right? It's taken that strawberry and that New York City Diesel. Strawberry Cough, I guess, is what the strawberry is.
I would say it looks, they say it's a 60-40 sativa to indica, but I'd say it looks definitely like very sativa.
That's a
that
sativa
really
looking
foxtaily
bud,
kind of bud.
Yeah.
Nice light color.
Yeah, I definitely feel the sativa effects are much stronger than the indica side, so that makes sense to me. Pretty good, I would say, a daily daily use? It's not
Yeah.
too heavy. It's
Yeah.
not going to knock you out. Or
Yeah,
anything
bring
like
lots of
that?
water.
Yeah, man, this one turned my eyeballs into dry balls. Let me tell you.
Yeah, dry mouth,
Dry
indeed.
mouth too. Yeah.
But yeah, nice strain.
Yeah, it's nice. Really nice job.
Yeah, strawberry diesel.
So, what is microdosing? The technique of taking small quantities of a substance for therapeutic purposes is called microdosing. Do you want the mind-body effect of cannabis without feeling too high? Grab your cannabis journal and start experimenting with microdoses. Cannabis is bimodal. At low doses, you get one effect, and at high doses, you may get the opposite effect. For things like ADHD, many have found that a few microdoses a couple of times a day enables them to settle down and to focus. So how much is a little? A suggested microdose is between 2.5 and 10 milligrams. In an oil from CannTrust, for instance, this means 0.1 to about 0.4 milliliters, so a tenth to a quarter of your milliliter dropper. If you're vaping or smoking it, be aware that one inhalation can have up to 10 milligrams, depending on the strain. Microdosing cannabis, especially with good levels of CBD, can help keep us healthy and in balance while safely managing stress and anxiety.
Hi, did you know that you can ask us anything? That's right. If you got a question for us, you can email the Cannabis Show at naturalhealthservices.ca. We got Basil here, Hart, and they're going to answer your questions. I'm Chris. Our first question comes from Regi, and it's an allergy question, okay? And they went on to say, what if you're allergic to pine? I have asthma and I've got approved for a prescription. Would love to use something that would benefit my asthma. However, is there another strain other than pinene that would help? First off, pinene is a terpene, is that correct?
That's correct. Yeah, pinene is one of our terpenes.
So what would you say for that?
I would say, excellent question. That is seriously probably one of the better questions we've got here on the Cannabis Show. In terms of being allergic to a terpene, I would say you might want to give it a shot. I mean, as long as the allergic reaction is not something that's anaphylactic, that you're going to put yourself in danger, you could give it a try. Yeah, because as an example, we know someone who is very allergic to mangoes, and using the strains that are higher in myrcene, there's no allergic reaction there. So, and as we know, mangoes are quite high in the terpene myrcene.
Now, pinene and pine, how close are they? Is it the exact same kind of thing, would you say?
It's just a sense that the pine tree, its essential oils make pinene. So it's an ingredient to the tree, but it's not the whole tree.
Could they maybe even use a little bit of dab of oil on their skin to see if they get an reaction from that way, or?
Why not?
Yeah, that may be a safe way to try it.
For sure.
Just a safe way to try it. Awesome. Well, thank you very much for your question. Again, if you got a question for us, you can ask us anything. The Cannabis Show at naturalhealthservices.ca. Fire away your question.